Hi, we're going to do a training on sensor placement or film placement for the patient's mouth. And so this is what the student is going to be doing. And when the dentist or instructor, mainly the dentist, is grading or evaluating the student, this is what we're going to be looking for in each image. So we're going to go ahead and start with the maxillary canine periapical. Up here it is bold, meaning that's the most important part of the image. So that right there is tooth number 6. The entire crown and root should show up on that image. It should be centered in the image. That goes for the same on the opposite side. I'm just going to show you one side though. Then you have your maxillary central periapical. The most important part on this image is number 8 and number 9, that you have the entire crown and root centered on the film. That goes for the same for the bottom teeth as well. We have our mandibular canine. Number 22 is what I'm showing. The entire crown and root is centered on the image. The mandibular central, tooth number 24 and 25, the entire crown and root are centered on the image. Maxillary premolar. Whether you're doing digital or film, you have to have the distal of the canine, the entire crown and root of the premolars. Okay? So those are what are most important. Distal of number 6, and then the entire crown and root of number 4 and number 5. The maxillary molar periapical, tooth number 2 and 3 are centered on the image, and you see the entire crown and root. Notice I did not worry about the wisdom teeth. The wisdom teeth are not the focus on in these images, because if we really need those, we are going to take a panoramic image. So on the maxillary molar periapical, we are going to focus on the first and second molar. We're going to talk about two different things here for the bottom premolar image. If you're doing digital, it is going to look like this side, and you're only going to get the premolars and a little bit of the molar in it. Sometimes you won't even get the entire molar or premolar here. It's because it's a little bit bulkier and a little bit bigger. But if the student is taking film, they must have the distal of the canine and both premolars, crown and root. Mandibular molar, it's going to be the same as a maxillary molar periapical. You're going to center the first and second molar. If you don't get the entire third, it's okay, because we'll come back and get a pano. The premolar bitewing, so this is for digital. When you're doing digital, you're just going to want to make sure that on the top, you're going to have the distal of the canine, and then the first premolar, second premolar. On the bottom, you're not going to get that canine, because remember, we're doing digital and it's really hard. So on the bottom, I'm not as worried about the canine. You have to have the canine on the max. All right, premolar bitewing, and this is with film. So if the student was using film, then they need both distals of the canines, the premolars, okay? Just the crowns and the bone. We want to make sure we get the bone in there. If we are taking for cavities, we are going to do horizontal. If we are taking for bone loss, we are going to do vertical. Molar bitewing. The molar bitewing is the same for film and for digital. You're going to center those first and second molars, and as long as you center those and you have the bone level, you're in great shape. Remember, we're not going to focus on those wisdom teeth, because we're going to get that in a pano. I'm going to come on down here and I'm going to show you how we do the exposure sequence here at Lakeland. We do the exposure sequence so that it doesn't mess up the students in having to take any retakes or double exposure, things like that. The preferences are typically set in each room, but sometimes they are not. So the student wants to make sure that they are always on the right box, because if they're not, they're going to end up with either have a retake or they're going to be on a different image that they're not trying to take. If you look, this would be the right side. This would be the left side. So this box right here is tooth number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.